Hi, my name is Lora McDaniel. Before we get started, I'd like to give the audience some food for thought. Hypothetically, if you were to give birth to a deaf child, what would be your first course of action? Many hearing parents have no idea what to do when they find out that their child is deaf. So today we are actually going to be talking about cochlear implants. Under the cochlear implant section, the American Speech Language Hearing Association says a cochlear implant is a device that provides direct electrical stimulation to the auditory nerve in the inner ear. Children and adults with the severe to profound hearing loss who cannot be helped with hearing aids may be helped with cochlear implants. This type of hearing loss means that there is damage to the tiny hair cells in the part of the ear called the cochlea. Because of this damage, sound cannot reach the auditory nerve. With a cochlear implant, the damaged hair cells are bypassed and the auditory nerve is stimulated directly. The cochlear implant does not result in restored or cured hearing. It does, however, allow for the perception of sensation of sound. With so many doctors pushing the use of cochlear implants after giving birth to a deaf child, it is important to have all the information on cochlear implants before making the decision on your child's behalf to implement them. Many people do not even have a full understanding what the cochlear nerve is nor its function. So, what is the cochlear nerve? Based on the online article, What is the Cochlear Nerve?, written by Daniel at wisgeek.com, the cochlear nerve, which is also referred to as the acoustic nerve or the auditory nerve, is the nerve that carries the auditory information from the cochlea to the brain. It is a sensory nerve, meaning that its role is to gather information, specifically sound, from the environment and transmit it to the brain for processing. The cochlear nerve begins in the cochlea, the auditory section of the inner ear, and extends to the brain cell, a small part of the brain through which motor and sensory nerves pass. It is a part of the overall auditory system, which is composed of many different parts that all work together for the goal of hearing effectively. The mechanism by which the cochlear nerve functions can be very complicated, but there are a few simple points that are essential to the process. First, sound in the form of vibrations hit the tympanic membrane or the eardrum, and it is, with the assistance of other parts of the ear, converted to electrical form. The electrical signal travels along the cochlear nerve and into the brain, where it can be processed into a form that is understandable to the mind. In the brain, the input from the two ears is processed and merged to an understandable stream. There are many different diseases and disorders that can affect different nerve cells, including the cochlear nerve. Such diseases and disorders act in different ways and can have different causes. Some kill the nerves entirely, while others damage them and impair their functionality. When this occurs, the nerves in the auditory system, hearing loss can occur, necessitating treatment that may include the use of hearing aids or cochlear implants. So, now that we have a better understanding of how the cochlear nerve functions, let us discuss how the cochlear implants actually work. Referring back to the American Speech Language Hearing Association, cochlear implants have external parts and internal parts that work together to allow the user to perceive sound. The external parts include a microphone, a speech processor, and a transmitter. The microphone looks like a behind-the-ear hearing aid. It picks up sound and sends them to the speech processor. The speech processor is a computer that analyzes and digitalizes the signals and sends them to the transmitter worn on the head just behind the ear. The transmitter sends the coded signals to an implanted receiver just under the skin. The internal parts include a receiver and electrodes. The receiver is just under the skin behind the ear. The receiver takes the coded electrical signals from the transmitter and delivers them to the array of electrodes that have been surgically inserted in the cochlea. The electrodes stimulate the fibers of auditory nerve and sound sensations are perceived. Now, according to the Before, During, and After Implant Surgery online article written by the FDA, primary care doctors usually refer patients to ear, nose, and throat doctors to test them to see if they are candidates for cochlear implants. The tests often done are examination of external, middle, and inner ears for signs of infection or abnormalities, various tests of the hearing, such as an audiogram, a trial of hearing aid used to assess its potential benefit, exams to evaluate mental and inner ear structures. A CT scan is also done. This type of x-ray helps the doctor see if the cochlea has a normal shape. This scan is especially important if the patient has a history of meningitis because it helps see if there is new bone growth in the cochlea that could interfere with the insertion of the implant. This scan may also indicate which ear should be implanted. An MRI might also be done and a psychological examination to see if the patient can cope with the implant, physical examination to prepare for general anesthesia. Referencing the cochlear implant section, once again from the American Sign Language Hearing Association website, about 4 to 6 weeks after the surgery, the person returns to the center to be fit with external parts, a microphone and a speech processor to activate the program, also known as mapping the implant. This initial fitting process is completed over several days and may include additional visits over several months. The additional visits are needed for activating, adjusting, and programming the various electrodes that have been implanted. Also, as the person develops skill using the implant adjustments and reprogramming is required. Usually, there are annual visits to the center for checkups once the final programming is made to the speech processor. Both children and adults receive extensive rehabilitation services from audiologists, speech language pathologists, teachers, and counselors as they learn to listen, improve speech, use speech reading, and handle communication. They are taught how to use the implant and how to respond to sounds they are receiving. For those who have heard before, the sounds through the cochlear implant may seem unnatural at first. Those who have never heard before need to be taught what sounds are like. Now, due to the rise in cochlear implants, there is much controversy in the deaf community on whether cochlear implants should be used. What is the Based on the findings based on biomed.brown.edu, written on their online article, Controversy Over the Cochlear Implant, technology has been extremely empowering for deaf people. However, there has been a notable resistance in the deaf community towards the technology of the cochlear implant. The deaf community is split between those that feel that it is a medical miracle and those that feel that it is a form of ethnic genocide. Deaf people have long been the victims of oppression. Many deaf people feel that ASL was their natural language and that oralism was a torturous process of speech and auditory therapy. It is true that only 35 to 45% of conversation can be understood through lip reading alone, and that communicating through lip reading can be very frustrating for deaf people. Proponents of deaf culture view deafness as a state of being, an identity, and not a medical condition that needs to be fixed. In fact, many deaf people do not consider themselves to be disabled at all and therefore not included in part of their identity. Deaf culture activists have an issue with the cochlear implant encouraging deaf children to be placed in public schools or mainstreamed. A major center for the distribution of deaf culture is in the deaf residential schools. Since 90% of deaf children are born to hearing parents, deaf schools are where children are introduced to the social life of deaf people. The schools traditionally have deaf teachers and play an important role in the deaf community. Thus, the mainstreaming of more and more deaf children will mean fewer are going to deaf schools and learning about deaf culture. Deaf culture activists also have a problem with implanting children at a very young age. It encourages them to be oral and places emphasis on speech and lip reading. Deaf activists feel not only that this is not only a natural or a comfortable way of communication for deaf people, but that making children hearing by implanting them denies them ASL and the deaf experience. In fact, deaf activists argue that the cochlear implant will prevent the deaf person from functioning in either the deaf or the hearing worlds, since he will never be fully accepted as a member in either group. The cochlear implant controversy is perhaps the most sensitive topic in deaf culture. So, is it a blessing or is it a curse? If you were to give birth to a deaf child, that is why it would be so important to have all the information on cochlear implants in order to make a confident and informative decision for your child. So, if you know what a cochlear nerve is and how cochlear implants work, and truly understand why the deaf community is against them, you are better equipped to make a decision for your deaf child.